Hello friends, today we are going to discuss about World Health Day 2021. I'm Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit working at NIMANS, Bangalore. In this video, I'm going to discuss about World Health Day 2021. Why should we celebrate? What is the theme of this year? Meaning of this theme and what we should do to achieve this theme. World Health Day. This is celebrated because World Health Organization Constitution came into force on 7th April 1948. We celebrate to commemorate the World Health Organization's constitutions came into existence. It is celebrated from 1950. The preamble of the World Health Organization clearly suggested that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without the distinction of race, religion, political belief, economic or social condition. That's very important, economic or social condition. Objective of the celebration of World Health Day is to sensitize, to prioritize and focus on important aspect of public health. Considering the pandemic in the previous year and which is continuing now, this year theme is World Health Day, building a fairer and a healthier world. This theme is very apt because this unequal world became more prominent and it became more widened between the rich and poor. The treatment gap has further widened. That means the people who are having diseases are not being able to access healthcare. They have been deprived of treatment, health services, and access to healthcare is becoming distant for poor people. And the difference between have and have-nots is widening day by day. Hence, this theme is very apt. No one should be put in a situation where they have to choose between availing health services or feeding their family members. Imagine if you have to choose between feeding your family members versus providing healthcare services to one of your family member who is very sick. That's a difficult choice to make, and half of the global population have to choose when one of the family member becomes ill. Often, the poorest are hardest hit. Those with little income to spare face a higher risk of disease, and they plunged further into poverty when paying for the healthcare services. Time is now to make it a fairer world. Post-pandemic world should be fair. That means right to access healthcare should be the fundamental right. Right to access healthcare means it is about ensuring all people and communities to have equal access to quality healthcare, where and when they need them without suffering financial hardship. Right to access healthcare means awareness about health, affordable healthcare, acceptable healthcare, adequate range, appropriate quality, and it should be across the borders of the nation. Because pandemic has proved that is not going to spare any country. It has not spared any economic strata. It has hit every country, every man on this globe. Adequate range of services means full spectrum of healthcare services needed throughout life, from health promotion to prevention, treatment, rehabilitation, and palliative care. Adequate range also means access to alternative complementary healthcare system. That means just not modern medicine. A person wants to choose alternative complementary healthcare system should also be made available for the citizen of any nation. And it should be based on strong primary healthcare system. That is, it should be community-based treatment, not just institutional-based. And the care should be provided within the family. That means the care should be as much as possible provided at home. And fairer because it should be enjoyed without discrimination on the grounds of race, religion, color, caste, gender, age, ethnicity, economic inequality, or any other status. COVID has proved we are not equal. We are unequal. We are divided. We are fighting. That means we have to unite to fight against the biggest pandemic the world is facing. And now is the time to focus on disadvantaged population who are at high risk of pandemic mortality. For example, poor people, disabled, senior citizens and high-risk population, gender minority, rural population, tribal population, marginalized population, refugees and frontline workers should be taken care before we go to the other population. And it should be quality health care that is safe, effective. Participation of community is essential, and it should be timely, equitable, integrated and efficient. Lesson from the COVID pandemic has been very clear. That means prevention is better than cure. Before the pandemic hits, the country, the state, the society need to do preventive measures like wearing mask, doing social distancing, and also protecting oneself from getting infected. Community care or the home care is the best care. 95% can be treated at home. That means it is easy to provide care at home, and also it is quality care without having human rights violation. And it should be by empowering the people of the local community, the care should be provided. And it should be cross-border. The technology should seamlessly move from one nation to another, because pandemic is not sparing any country or any human being. So we need to get together to fight against this global pandemic, and requires united proactive response. Without united proactive response, if we are divided, we will perish. United, we will survive. It is prudent at this point in time to have right to access for healthcare across the world, not just in one country or two country or in a developed country. Now, the developed country has to provide support to the developing countries. And international cooperation is much required now. And nationally, united proactive response is the essential ingredient of fighting against pandemic. Every society needs to work and protect the high-risk population. Health is everyone's business. Thank you very much for giving your valuable time. Stay safe.